We are joined today by Dr. Christopher Passariello, Orthopedic Surgeon at Community Medical Center, our guest from RWJBarnabas Health. Doctor, thanks for joining us today.
Hi, good morning. Thank you for having me.
Hi, Doctor. Good morning.
So, Doctor, what is a robotic surgery? What is robotic surgery?
So as far as the world of orthopedics is concerned, we've been doing robotic surgery for approximately 20 years or so. It was originally developed by a company which was called Mako, and it was subsequently bought by Stryker approximately 10 years ago, and they've retained that name. So it's actually a technology which has been around for a long time. And it's actually been perfected by Stryker over the years. The robotic surgery that we do at Community is specifically for knee and hip replacements. So whereas in the past, and we still did a good job in the past, but now we do an even better job because the robotic surgery works in the world of 1 millimeter. So if you can imagine, a sliver of a piece of paper, whether you're going to rotate it 1 degree or change the angle by 1 degree, we're able to do this with precision using the robot, whereas when we did this before, we were using our eyes, which really can't work in that world. We're not exact enough to do that. So the robot has really fine-tuned the joint replacements that we're able to do today.
It's amazing. Does the robot actually perform the surgery?
No. So how the robot works, it's actually a robotic arm, and that robotic arm is actually held by me. So what we do is we get a CAT scan of the knee or the hip, depending on which surgery we're doing. That CAT scan actually goes from your spine all the way down to your ankle. So we get a rather significant amount of data from the CAT scan alone, and the CAT scan works in the world of 1 millimeter also. So we take into account your spine angles, your hip angles, your ankle, how your foot sits on the ground. And then we come up with an actual plan. And what it is we use something that's called a mechanical axis. So when you get wear of your knee, typically people will wear it in one area. So you can imagine, if you see people, they have, very severe bow legs, or they have legs that are knock-kneed. And what we actually do is correct that with the surgery so that we get that straight angle again.
It's amazing.
The actual robotic surgery itself uses that plan from the CAT scan, and then I also register the knee at the time of surgery, and then we're able to make that correction. And what we do is we balance. It's called balancing the soft tissue, meaning that we get the leg straight. So we do, the robotic surgery is actually on the bone, but we take into consideration the soft tissue because you have ligaments in the knee that need to be balanced so that the knee is then straight. The robotic arm doesn't do the surgery itself. So again, it's my hand which is using the robotic arm so that we get those perfect cuts. We're able to replicate the angles that we're shooting for off of both the CAT scan and then at the time of surgery.
Doctor, what are the benefits of robotic surgery at CMC?
So the main benefits that we've seen right now as far as my practice is concerned and as well for other surgeries, number one, the actual knee that we're putting in now is really feeling like a natural knee once we get the patients recovered. So we've been using now, and we've used them in the past, but with the robotic surgery, it's gotten even better. We're using an implant, which is a cruciate retaining implant, meaning that we only have to remove one ligament in the knee, and that's your anterior cruciate ligament, but we actually replace that ligament with the implant. We're now keeping the posterior cruciate ligament, and then we're using a specific implant for that. So it's basically preserving the majority of your natural knee, which then gives you a knee which feels very natural. Now, the bottom line with all of that I said, the better the knee feels, the easier it is to move. stiff knees after a knee replacement hurt, if you get that full range of motion, and in the past we would tell people get to about 120 degrees and you'll feel good. I tell my patients now we're shooting for 135 degrees, 140 degrees. Imagine grabbing your ankle and pulling your leg all the way back, and you're able to easily do that, no problem. That's a knee that doesn't hurt, and that's the range of motions that we shoot for now. So we used to accept less range of motion, and the patient's knees still didn't hurt, but they would still have difficulty doing things like if they're looking to walk very fast on a treadmill, if they're doing cycling. The main thing, and we used to tell patients in the past that you'll never be able to kneel on your knee, and we get quite a few patients, and actually the majority of my patients are actually able to kneel on their knee afterwards. It wasn't that the implant was causing pain, it was the fact that the knee didn't bend all the way back. So the patients would get pain when they would kneel, and now we're seeing that patients are able to easily kneel. So there's really, as far as, after or starting to do the robotic surgery, there's no limitation that I can really put on the patient anymore. Like I said, I used to tell them, you're not going to be able to kneel on this, and now I tell them the opposite. You will be able to kneel.
Oh, that's
amazing. It takes
amazing.
about a year or so before they feel comfortable doing that, but the majority of patients
So the
can
procedures of the robotic procedure that you do, the surgery, is it shoulder and knee only, or are there more?
So right now it's only, as far as at community and using the Mako robot, it's hips and knees only right now.
Okay.
It's in the process right now. I can't tell you exactly when it's going to happen, but it should be within the next couple of years. That same robot is going to have spine and shoulder applications.
Oh, wow.
So that's going to be in the future. But right now it's hips and knees. I think within the next 2 years it'll be shoulder and spine also.
Okay. Well, wow. That's pretty amazing, isn't it? From what you went from to what you get to work with now, it's amazing.
Yeah, absolutely. And the best part about it is that it's really good for the patient. So we've seen significant improvement in their outcomes and how they feel with their knees and hips.
Amazing.
That alone is what makes it special.
For more information about robotic surgery at CMC, visit rwjbh.org/CMC Robotics or call 732-349-0988. Dr. Christopher Passariello, thanks for joining us today and shedding some light on this robotic surgery.
Thank you.